the doctor, they are very cooperative. Even the students who come here.
I can say the ref of this hospital for now, it's like the way I'll go to Aga Khan, because the attendants, the way they are taking care of us, it's quite good.
Mtu akija kwa hospitali katika Kiambu County anakuja na card, na yule hana card anakuwa registered on the spot at the hospital.
Nimetoka Kayole. Kiambu nimekuwa nikisikia uzuri wake, nimekuwa nikiambiliwa na watu ati kuna matibabu mazuri, wadaktari wa huku wako sawa, na nimeona hivyo wako sawa kabisa. Usiku wanalala wakitutibu, tuangalia, hawalali mpaka mchana.
The last few years since devolution have witnessed profound changes in the healthcare landscape within Kiambu County. This is evidenced in the progress the county is making towards increasing accessibility, improving quality, and enhancing affordable healthcare services to all its residents.
The population of Kiambu County is 1.9 million. It's divided into 12 sub-counties with 60 wards. In Kiambu County, we have 107 health facilities, and the 108th is the Beyond Zero mobile clinic. We have 3 level 5 hospitals in Kiambu County. We have 11 level 4 hospitals in the county, 25 health centers, 70 dispensaries, and 120 community health units.
Kiambu County Health Services serves more than 10,000 outpatients and 2,000 inpatients on a daily basis, with a staff of more than 2,700.
I'm born here in Kiambu, so I used to come to this hospital even before devolution. And from the time of devolution, the last 5 years, there is a lot of improvement in health services in Kiambu. And we are hoping it will continue to another level.
Kiambu County is committed to universal health coverage, that everyone should have access to health services they need without risk of financial ruin or impoverishment.
Universal health coverage is one of the 4 agendas of the President. And as a department, we are very glad to be associated with that agenda, because we believe it is the way, it is the ultimate towards achieving proper, affordable, quality, accessible health to our people without having to use money from their pocket.
Sisi tunataka kuashua watu wote wa Kiambu ya kwamba hii campaign ya kurejista kwa NHIF, sisi kama county tumereserve 12 million shillings during this financial year, ambaye tutahakikisha tunalipia wale hawajiwezi kabisa shilingi 500. Ndio kila mwananchi katika Kiambu, hata yule mdogo namna gani, tuweze kumwanzishia kumulipia, na tuta make sure ile target tumejiwekea ya 800,000 people by November, tutahakikisha pia tumefanya kampeni ya kutosha. Tusaidiane na community health workers wetu, pia tunasaidiana na wa MCAs ambaye kila ofisi yao kila mmoja atakuwa na that gadget ya kuregister, na pia tunapeana kwa our members of parliament, ndio kila mtu kwa ofisi yake akiwa mjumbe kuwe na mtu ambaye anaweza register through that modern system.
Every citizen in Kenya should have that scheme, the NHIF scheme, because it is really helping people. You can imagine without NHIF, how much would I have paid really? How much can I pay in a given time? How many people can afford?
Demo member wa NHIF kuma miaka 3 guo mithiru na nĩ nyonete ĩno ũteithio mũnene kũringana na ndoka gũkũ rĩ nĩ kabĩte expenses iria ciothe ndĩrahũthĩrire.
In addition to increased affordable healthcare, the health department celebrates other key achievements.
Reproductive health is one of our major priorities. We have 16 gynecologists in our county to ensure that this specialized care. We delivered 61,000 babies in the year 2016-2017. Our maternal mortality ratio right now stands at about 50, between 50 and 60 to 100 live births. The national maternal mortality ratio is at 362. And we are now working towards ensuring that we have zero maternal or child mortality within our county. We were able to open a blood satellite center at a Thika level 5, which is now able to provide between 800 and 1,200 units of blood. The biggest cause of maternal mortality is hemorrhage. And immediately we commissioned that blood satellite, we noted a drastic reduction.
Hospitali zetu sasa ziko na dawa. Recently we paid 42 million ya kuleta madawa kwa hospitali zetu. Mtu asikudanganye, mtu asipige porojo, tuko na madawa ya kutosha na ile consignment nyingine inakuja this week. Kwa hivyo kila kona mtu aende kwa hospitali zetu ziko na madawa.
Since devolution, 445 health workers have been recruited through the Kiambu County Public Service Board.
I'm in maternity. The place is quite busy compared to where I was previously, so I am learning new things. For example, like today we had like 72 patients, 72 mothers, and so in a day I'm able to interact with quite a number of them. Right now, with the devolution coming even closer to us, we're able to view our issues even as the health workers closer to our managers.
The training of the health staff in the county has continued to improve their skills in handling patients.
As we speak right now, we have more than 50 doctors who are in various medical schools doing their master's programs. All these are under our sponsorship in that we are the ones who are paying their salaries as they continue studying in school.
Recently myself, I was a beneficiary of a training where we went to King's College and the renal observership program for 6 months. And I can say, yes, there is the benefit of, for me, there was the benefit of being trained so that I'm able to better care for patients who have renal issues, diabetes, hypertension, and all those things.
Kiambu County has 21 ambulances and is procuring more to improve referral services in the county. Kiambu County Health Services is renovating, rehabilitating and equipping existing health facilities and establishing new ones.
We are just about to commission our reproductive health unit at Thika level 5 next month, and it will offer a state-of-the-art reproductive health services. When you go to Larry sub-county, you'll find we are about to complete a 150-bed hospital. If you go to Kikuyu, the water, you'll find that we are also doing a 150-bed hospital. If you go to Wangige, you'll find that we're also doing a similar project. If you go to Tigoni, you'll find we are doing a similar project. We did a groundbreaking for another state-of-the-art hospital, which is equivalent to what we have just come from doing in Thika level 5 at Gedongori. It will be able to provide state-of-the-art services, especially in the area of oncology. When you go to Bibilioni, again in an area called Garariga, just near Lemuru, again we did a groundbreaking for a 300-bed hospital. And we believe that those infrastructure will go a long way in addressing the issue of bed capacity, ensuring that one bed, one patient, rather than the scenario which you'll find in some of our hospitals where more than 2 patients are sharing one bed.
The national government has invested heavily to make access to healthcare a reality.
We have a 6-bed ICU at Thika level 5, and this is courtesy of the managed equipment services. That means our patients who require intensive care do not have to go. We also have now the dialysis, which I've just mentioned. We have state-of-the-art theatre facilities, both in Thika level 5 and in Kiambu. We have centers for sterilization, for surgical equipment in both of the hospitals. Really, this has gone a long way, courtesy of the partnership with the national government.
The Kiambu County Health Services has continued partnering with various public and private partners to enhance service delivery, especially in the provision of specialized care. An example is University of Nairobi CRIS project that procured and installed a gene expert machine at Kiambu Level 5 Hospital that assists in the diagnosis of resistant tuberculosis cases.
The test is free. It's based on DNA. So it's a very good test, and it confirms whether you have TB or you don't have TB. And especially for patients with resistant TB, it is really beneficial.
In order to deliver quality healthcare services to its people, Kiambu County Health Services Department has zoned health facilities into centers of excellence.
These are hospitals which are flagships, so they are able to provide all basic services that will be offered by any hospital, but they have a flagship which they identify themselves with. For instance, the reproductive health unit in Thika level 5 ensures that Thika level 5 is able to be a center of excellence in reproductive health. We have earmarked Tigoni as a center of excellence for pediatric care. When you go to Lusigate, which is in Kikuyu sub-county, it's a level 4 hospital. Again, we have earmarked it as a center of drug and substance abuse. Right now, you appreciate that our governor is in the forefront fighting alcoholism, and we know that alcoholism has an aspect of medical care and, of course, psychological care, and we have identified it as an area which can serve that purpose. When it comes to where we are in Kiambu Level 5 Hospital, this is going to be the center of excellence for neurosurgical sciences. Now, in an effort to address the issue of non-communicable diseases, we have established a center of excellence for non-communicable diseases in Gatundu Level 5. So the whole idea is to optimize on the scarce resources and also to ensure that we are able to provide specialized care within our county.
In November 2017, Kiambu and Gatundu hospitals were upgraded to Level 5. The county now has 3 Level 5 hospitals and is working to upgrade other facilities.
In infrastructure, we need facilities, we need equipment, such that our patients will not walk more than 5 kilometers to reach a health facility. So we have already mapped areas which have a longer distance between facilities as areas where we are putting up new facilities.
As Kiambu County Health Services celebrates their milestones in achieving universal health coverage, they recognize and appreciate the support of their esteemed clientele, partners, team of dedicated healthcare givers, and the county assembly membership.
In Kiambu, we want our residents to be the most healthy so that they can work with comfort, they can build the nation with comfort, and so that our county gets richer and richer. And I repeat again, a healthy county is a wealthy county.